welcome everybody to our web meeting of our QIOnTheFly web series. This is using perception of care indicators for rapid improvement cycles, the how-to sequel. We're very excited that you joined us all today. Today's webinar is brought to you by the Excellence Through Quality Improvement Project, better known as E-QIP, which I know is familiar to many of you. We could just go to the next slide. So we're just going to overview the primary controls of Zoom for those of you that have not used this platform before. So at the bottom left, you'll see a microphone and a video icon. This is to control your sound and your video. We do have folks muted and off camera by default, but if you would like to speak to ask a question at the end of today's web meeting, please unclick the mute. And if you wish to show your screen, please do so by clicking the camera. Today's session is being recorded. We are not recording the gallery view, and we will be posting today's web meeting on our YouTube channel as well as our website. By no means are you required to show your video during today's web meeting, but if you choose to do so, please feel free. Just go to the next slide. And this little blurb icon in the corner is the chat icon. So if you click on that, you can type a question to the group or an individual member of who is joining our meeting today. We'll be asking you to use the chat to let us know a couple questions, like where you're coming from today. During the meeting, we do ask that you use the chat if you have a question during the session, but to please avoid speaking, just so there's not too much audio background. We'll go to the next slide. So before we get into the learning objectives, if you could please use the chat function to please let us know what region of Ontario you're joining us from today. We're looking for the North region, East, West, Central, or Toronto. Nice to see some familiar names pop up. Great to see so many people joining us today. Great. Thanks so much. So objectives for today's meeting is we would like you to think about what you want to know about your client or tenant experiences with your service right now during the COVID pandemic, to learn how to use the new OPOC scoring tool designed for rapid PDSA or Plan, Do, Study, Act cycles to gather client data, and also to understand how to talk about and do something about your data story. Go to the next slide. So this is providing just some grounding for why we developed this QIOnTheFly series at the start of the COVID pandemic. We are facing unprecedented times with many competing priorities. Many of you are balancing safety for all with client and tenant needs. We're hearing about creative approaches, which are essentially change ideas that are being implemented rapidly and altered as you gather data, and input from team members and clients and tenants about what is working, what is not. And we wanted to capture these so that we can share broadly within the sector. And we know that some of these change ideas will continue after the pandemic is over as new ways of operating, and others may be more relevant to the COVID-19 experience. And we felt it was important to talk about that and capture this for reflection, future pandemic planning, etc. It's a very unique time. We just go to the next slide. Perfect. So today's panelists are Debbie Bang, who is the Director of Quality Improvement at Addictions and Mental Health Ontario, and Deanna Huggett, the Manager Implementation at CAMH Provincial System Support Program. So lovely to have these women leading us through our webinar today. Okay, so a bit of a recap. On April 22nd, at the first QI on the Fly webinar, we reviewed how to get a better understanding of the problem at hand using virtual technology, and we did a virtual fishbone together. And on May 6th, we talked about how you'll know if the changes you're making are resulting in an improvement, particularly as it relates to the client experience, which brings us to today, where we're going to get into more detail about the how. So in our model for improvement there, you can see we're at the measuring and understanding your system. How will we know that change is an improvement? And on the right-hand side, you'll see a nifty little template. We're calling it our quick QI template, which you can find on our website, and we're happy to share. This is to help you capture your quality improvement work during COVID-19. And with that, I'm going to pass things over to Deb.
Good morning, everyone, and thank you very much for being here with us this morning or this afternoon. We've got a kind of an exciting piece for you today, and I think you will be able to walk away from this webinar with some thoughts on how you can get started tomorrow, if not today. So just to recap from last time, we talked a lot about client feedback and the way that it helps us to understand whether or not we're meeting our client needs or whether or not we're not meeting our client needs. We talked about collecting data in a sort of different way that PSSP is offering using the OPOC to have some starting questions, a couple of questions that make sense for asking right now as opposed to the full OPOC. And we invited people to think about using some of those questions as part of a quality on the fly activity, those very fast, rapid changes that you're making right now. And then we talked a fair bit about Nancy's example from Peel Dufferin and the work that they're doing, some very innovative work that they're doing, and how they're using a couple of questions in particular. I think it's 2, 9, and 30 from the OPOC that they're using to better understand their client experience, as well as some other questions that they're asking after they finish a service or interact with a client. So a great example from Nancy. And really the purpose of doing this work is to tell the story about the sector. As you all are very familiar with, the challenge for our sector is that people are living in the community, but they're presenting in hospital really, really ill. So that's where some of the priority is around supporting people, supporting healthcare workers, and lots is happening in the community. And the QI on the Fly gives us a chance, the community mental health and addiction sector, to tell the story of the really innovative and work that each of you are doing or involved in, and some of the changes that are going to be ongoing, and I believe are going to make a difference in meeting some clients in a different way. All right, next slide, yes. So what we wanted you to think about, we've got a couple of questions for you, and we're going to show you some ways to pull this information, how easy it is to input it. Deanna's going to do that. Rishikesh, our new data coach, assisted me to make a run chart, which we're going to show you, and the importance of using the run chart. But all of this magically happens when you insert the data from your client feedback, from your OPOC questions. So it's a brilliant program that Derek worked on, and with a little bit of help from Abel, from one of our data coaches as well. So it's a really great template for pulling this information, getting some very important information from your clients, and then being able to tell them. So if you think about right now, and you can add this to the chat box if you would, what do you want to know about your client or tenant's experiences right now? So if you had a chance to ask clients about the service they're receiving from you right now, what would you want to know? What are the things that you'd like to hear from them? So just give you a second to add a couple of those to the chat box. And Chris, thank you for monitoring those. And if there's a need, you can let me know about some of those. But maybe we'll go on to the first one, Deanna. Often we want to know about services and supports that are provided. So what are we actually providing for the clients? Another one that we might want to know about is access. So specifically, whether they're getting the services that they need and want. Environmental safety for those who are living in our buildings, or we're involved with them in buildings. And then perhaps some overall experience. So for instance, Nancy's work, she looked at number 2, which is about service provided, about access. She looked at number 9, so how is the service provided? And then she also asked the question about overall experience. So number 2, when I first started looking for help, services were available at the times that were good for me. So perhaps that's a question that would be useful for you to know. Number 9, responses to my crises or urgent needs were provided when needed. So clients at this point in time, some are feeling very supported in the virtual ways that you're doing it. Others are not feeling as supported. And if there's some learnings from that, wouldn't it be great to make some changes now and make that better? Under environmental safety, a couple of options there. Staff are responsive to my concerns about safety. So perhaps they're living in one of your buildings. The program accommodated my needs related to mobility, hearing, vision, and learning. So there will be a number of clients who will not do well on the telephone, but might do okay in a face-to-face, like a Zoom kind of meeting or an OTN kind of meeting. And then the overall experience questions, number 30 or number 34 in the supportive housing OPOC, services and supports I received helped me to deal more effectively with my life challenges. So just some examples of questions that you might use from the OPOC to really understand what your clients are needing to know right now. And the next one.
Just before you go on there, Debbie, Chris Babcock has said that one of the questions she would have is, what would you have done if we were not available to provide services virtually or in an alternate way, as well as questions 2, 9, and 30, which were what Nancy from CMHA Peel Dufferin had picked, and question number 11 as well. We can try to pull that up and put that in the chat box in a second. And Koshi, are you able to use tools that are available to them? So that would be sort of an access question, I would guess. So in terms of the tools that the agency has and whether the client is able to actually use those tools.
That's right. So if we've got an OTN meeting, does the client have a cell phone that they can receive that? If you're wanting to provide a Zoom meeting, does the client have internet, whether it's on a smartphone or a tablet at home where they can connect? Or possibly they're needing to go to a location where there's free web available. However, that's not always private, and so some challenges around that. And a number of agencies have figured out some ways to get around that. So we've heard from some of those as time goes by. Thank you, Chris, for that suggestion as well. All right, if there's any other thoughts you have, things that you'd like to know, we're going to ask this again in a couple of minutes. So we will we'll bring you back, but we just wanted to whet your appetite there. So the key things before you begin to ask those questions is, what is it, what part of the experience would you like to improve? And what's your plan for collecting information? And what's the best approach for collecting this feedback? So how do we improve? How do we hear from the clients as to what's working and not working for them? And then what it is if you can add your thoughts around this, around the chat box, it's asking the right questions. So sometimes there's some additional questions that would be important to ask. Does it matter whether or not there's a particular experience or diagnosis that this particular client has? Does it depend where they are in the city? Would you like to know that information? Or maybe you know that as soon as you know who it is you're speaking to. If it's a particular activity that's challenging to connect people with, do they have some ideas as to how they might have their needs met? Again, what would you like to hear from the clients? Asking the right questions and then getting that information back. You can't do anything about information you've not heard. If you didn't ask the right question in the first place, you're not necessarily going to hear what you want to hear. So what's your plan for getting the data? How are you going to do that? And we're going to talk about some options for doing that today. And what's the best way to approach clients? Is it someone else asking the question? Is it right after you finish the interaction or engage with somebody? Is there other ways that you might do that? Okay, next slide. So part of the reason that we're encouraging the use of the OPOC, a number of reasons. One of them is that the ministry that funds us is very interested in clients' perception of care. So that's kind of a biggie. Our funder is interested in knowing what the client's perception of care is. for those of you who are actively involved in the OPOC, these are familiar questions. Your client has heard this question before, have responded to this question before. The wording is familiar. They know how they feel about it. So it's a great way to ask similar questions that are familiar to them. You also potentially have baseline data to compare pre-COVID and post-COVID. So you can get, and now you can gather information about a couple of questions right now during the pandemic, which you'll be able to look at over time and again to make some decisions. And we have all kinds of resources available to help you right now. So PSSP is available, the implementation specialists are available, the E-QIP coaches are available. We're all very keen to help you to record what's going on right now so that we can tell the story about how the community mental health and addiction sector supported people during the pandemic. Next slide.
So I think that's our transition point, Deb. So thank you very much. And what I'm going to be able to do is actually pull up the tool that Debbie was mentioning, and which we briefly showed at our last session, which is a scoring tool and a tracking template and a reporting or a way to produce reports and a way to produce run charts all in one. And as an added bonus from our webinar 3 weeks ago, Abel and Derek actually worked on developing a run chart tab that does all its behind the scenes magic. So thank you. And just want to flag again the importance of why we're doing this and what's in it for you. And so the ability to gather information and feedback quickly and easily to help you identify the direction that you need to go in. And Debbie will talk a little bit more about building that data story in a little bit. Right now, what I'm going to do is actually stop sharing and pull up another screen. So if you just give me 1 second here. Okay, so this tool is the magic tool. At our last session, we showed you this briefly, but also heard a little bit more from Nancy from CMHA Peel Dufferin about how they have used SurveyMonkey to capture the information from their clients. And that is a great approach. And if you have access to that and can set that up, that's fantastic. If you don't, or if this is an easier version for you, then this is just something that we have set up to help you along the way. So the first thing I would say is read the instructions. So there are a number of tabs at the bottom here. You will see an instructions tab, a data entry tab, a report tab, run chart tab, and stacked bar and pie charts. And if you read the instructions, they will very clearly indicate for you which of the cells that you are supposed to put information in and what magic will happen when you do that. So for example, this particular step 5 talks to you about how you will, you can use build the OPOC report, which looks very similar to the ones you're familiar with on the OPOC website. Information instructions on looking at the stacked bar and pie charts, stacked bar graph and pie charts, and then what to do for the dynamic run charts. And so if you follow these handy little instructions, all will be well. Now, Derek has set this up to be as foolproof as possible and protected certain cells, which good thing, because when I was fiddling with it, I did a good job of messing things up a little bit. So he has subsequently made it a little bit more foolproof for the rest of us, and hopefully that will work for you. So I'm going to pop into the data entry tab right now. What you will see is that we've already pre-populated with this with a little bit of data and selected a couple of questions. So at the top here, you will see you will want to add either 1 for a client or 2 for a family member. So probably the majority of your respondents right now will be clients themselves. So you will select 1. You can quite easily then copy and paste into the remainder of the other ones. If you want to put your particular program in that you're referring to, you can do that. You might want to save this as a different version for each program, so you're not kind of clumping the information together, or you can certainly clump it together too. All you need to do is enter the date when you received the information from the client and the client's response. So did they respond a 1, they strongly disagreed, or up to a 4 that they strongly agreed. In here, you can actually select the OPOC question that you're interested in. So it's a drop-down menu. You can select question 2, for example. You can select, in this case, we had question 9. And there are 4 options, or there are 4 columns available for you to do that. If you wanted to add more, you could certainly do that, but we've just pre-populated with 4 options for you to try to keep it quick and simple. I'll come back to just doing a real quick data entry for you in a minute. What I will also show you is the next version here, which is the report. And this will give you the date and also bring up a report that looks very similar to that which is found on the OPOC reporting portal. So it gives you the question number, which is pre-populated. We chose question 9 and question 30. We only had 2 questions. So these last 2 at the bottom are blank. And it tells you the number of respondents that answered strongly agree, as well as the percentage, and compared to those who granted agree, disagree, strongly disagree. It also will tell you your response rate. Now, this is the only thing that you actually have to populate on this tab. So for example, you have to put in the number of responses. So on data entry, I'm going to see that I have, okay, it started at number 3. I have 90 responses, so 90 minus 3 is 87. And so that should be, oh, Derek, what happened? Pre-populating will fix that error for you. If you enter 87, it'll populate into, should be 100% of your responses there. So this should be the only one that you enter is the number of responses on this particular one. The other thing that I will show you, just based on your response rates, is the percentages of strongly agree, disagree, agree, and strongly agree. So all of those that entered into the response categories will show up in a stacked bar graph here. And so again, this is pre-populated from the other information. It will show you kind of how you can compare all of your answers in terms of the percentages of those that disagreed. You could see, for example, in this subset, that there are more individuals who disagreed with the response to question 30 than to question 9. It will also give you a pie graph in terms of the percentage of respondents that were registered clients versus family members. In this situation, we had 100% were registered clients. And I'm going to show you this run chart tab as well, which looks a little bit busy. But what you can see is that it will show you either on a monthly version or a weekly version your responses. And so you can see over time, compared to the median, how the responses differ. And also a little bit more variability in the weekly responses. And Debbie will talk a little bit more, walk you through run chart information and interpreting the run charts in a little bit. I'm just wanting to show you exactly what happens here. This particular tab, in order to make these work, we do need to enter the question number. So for example, if you picked question 2, you would have to change this to question 2. And then over here, to make it work for question 2, you just need to make it work with question 2 and the median for, whoops, the median for question 2. Okay, so this one requires just a little bit more finessing. Once you've done it once or twice, you will get the hang of it. I'm going to flip it back to question 9 again here, because that's the one that we actually had the data for. And you will see how very quickly and easily it switches for you. You could then quite quickly switch that, say, no, actually, I want to look at question 30, so I'm going to change the chart to question 30. Make sure I put in the right mean or median for question 30 and see how nice and easily that switches for you. And you can do the same for your weekly charts compared to your monthly charts. The last thing that I'm going to show you is just how quickly and easy it is to actually enter data. So I'm going to go to the bottom of our chart here. I did have this populated from January through August. So I'm going to add additional information for August. So I just enter the date, I enter the program. It was a registered client. They answered question 3 or responded to survey to response number 3, and they responded number 2 for question 30. And that's it. So you just, maybe you're getting 2 or 3 a week responses. So you enter those 2 or 3. And then I will give you a couple here. And we'll see how it populates on. And I can copy and paste these. However their responses might go. And then I will see on my run chart that we've got a new data point down here. So before I carry on, I would like to ask if there have been any questions that come up, or if we'd like me to review anything more from this particular chart. Now you can see there are 92 responses, so I will change this to the fact that I entered some additional information. And
yeah. Dan, it's Chris here. No, there have been no questions coming up other than how can people get their hands on this lovely tool?
This lovely tool will
and
be sent.
Yeah, it will be sent out to all the participants and the registrants, I believe. You don't have to be in attendance to receive it, along with the slide deck, survey, a link to a survey for today's session, and so on.
Yep.
Right?
And the other thing I would just say is if you would like a little bit of support in figuring out how to use this, the OPOC implementation specialists who you are likely familiar with can walk you through it once or twice if you need some help, and certainly the QI and data coaches from AMHO and CMHA can support this as well. I think once you've done it once or twice, you'll see that it really is very, very easy to use.
So just Derek came in and explained the why the 88 versus the 87. So it's in the chat box if people want to have a look. So he's recommending that you highlight the rows in the data entry tab, count the number of cells. So
yeah.
Marty Pants, Derek. Thank you for that.
Derek, feel free if there is something else you want to add about this beautiful piece of artwork, then feel free to pop in. I'm sure I haven't done it as much justice as the behind the scenes work that there is to it.
No, that's great. Thanks, Deanna.
We think of it as magic.
Yes, indeed we do. So I am going to actually pull up our slide deck here again now. And then I think we'll be turning it over to you, Debbie. There you are. Okay, these were our backups in case there was technology issues. So Debbie, over to you.
Thank you. So thank you again to Rishikesh Navar for helping to build these run charts as our example. So if you look at this run chart, we've done a little bit of annotation on the run chart as well. This is actually the monthly run chart. You can see the yellow star is that information that we knew pre-COVID, so your past OPOC questions. And then the pandemic started. So that there was a drop in question, in this case, question number 9, that dropped. So people were not as happy with the access to support that they were getting. And then there was some notions about what might we do about this, and some introduction of some change ideas. And it looks like the first one was the purple one, and there seems to be some improvement. And then there was the green change idea, the second one, which may or may not be holding as improvement, something that we might want to monitor. So does this make sense to people? If you want to say in the chat box, is that easy to add these little stars, easy to plot? This is directly coming from the template that we just looked at. So I'm seeing you saying.
Great tool, makes sense, nice feature.
Perfect, thank you. Can you go to the next one then, Deanna? I especially love the weekly, and for some people, you may be monitoring daily. You may be doing it that frequently if you're making it very rapid, because you may only use a couple of clients or a couple of experiences to really help you understand what's happening or what your change idea, what difference it's making. You may do it, if you remember with quality improvement, it's good enough data, not randomized control trials. So we have small numbers of people, small changes, and test it over a small period of time. And then if it's making sense, we might want to continue it. So again, you can see the yellow star where it was pre-COVID data. And for the most part, it's bouncing around in kind of a normal range. And then we get to the pandemic, and things started to drop off at this point. Clients did not feel as supported as they were in the past. Change idea introduced, there was some improvement starting to happen. Change idea introduced at the purple dot, and then another one at the green. So there was some improvement that was occurring, getting better scores from the clients that you were polling. And then you've got another change idea, perhaps a variation or a tweak to the purple change idea. And again, the data seems to be holding. You'll need some more information to see over days whether or not your change idea is really working, but a way just to plot all this information and really understand what's going on. Making sense?
Good idea posted in the chat box about considering, if available, data from a year ago, this time a year ago, perhaps as a comparator, use as a comparator for data gathering efforts that are happening right now.
Brilliant idea. Whose idea is that?
I'll make sure. Raquel.
Oh, Raquel, very, very clever. It's the more data points you have, the better you are able to tell your story. So because normal random variation can be quite up and down, and that's very normal. So if you've got some background data, you can compare this to last year's data. Brilliant, brilliant idea. So please do try to include that as well. All right, next slide.
The only other thing, Debbie, that I was just going to mention was just reiterating that when you're using select OPOC questions, the information does not go in the OPOC database. So only the full OPOC scores, well, however many the client completed as part of their full survey, are included in the OPOC database. This is a separate process. So as you were mentioning, in terms of looking at the baseline data, you will have to pull that some of that information and populate it into the tool to be able to use the run charts. But you can certainly also use the information and use it, starting today and looking at it moving forward, and kind of seeing how that changes over time as well.
All right, thank you. All right, next one. So I want to spend just a couple of minutes talking about the data story. So what does this information tell you, and what might you do about this as a next step? So in the case with the run chart, we saw that most clients responded positively over the long term to question number 9. It's pretty steady, random variation. So responses to my crises or urgent needs were provided when needed. That changed when COVID happened. There was a drop in those scores. People did not feel as engaged, or that the team were responding in the same way that they needed. So the agency identified some possible change ideas, and I'm going to invite you to think about some change ideas that you might like to come up with, or what you might think could make a difference, and would love to hear those in the chat box as well. So things that you think could improve the scores around people feeling that they were being engaged with, or that they were having their needs met during the crises. But you can see from the run chart and from being able to enter that data that there's a story to be told here. And if you got some data, as Raquel is mentioning, a year ago, you had really good scores. There was no changes. It was very stable, or the same thing happened. Maybe it's a May thing, but I highly doubt it's just a May thing. It's probably more likely a COVID thing. And so when you have some change ideas, what's worked, what isn't working, what might you try, might you tweak, how might you make this better? So people can add any thoughts in the chat box of what might contribute to the run chart changes? What else might have, so what were those change ideas that the agency tried, or things that you've tried? I don't know if anything's...
No, nothing coming up yet. People are thinking.
Thinking, all right, well, we'll let you think for a moment then. And then
Debbie, maybe while I just had one question come to me privately, so maybe I'll just respond to that while people are thinking. So just a question again about the use of the provincial database, and could, if you picked 4 OPOC questions, could that data be entered into the provincial database and used in that way? And unfortunately, the answer to that is no. So if we did open the provincial database up to these rapid QI efforts and not using the full OPOC, it would really throw off the data for both the organization and the program, looking at it overall, but also the provincial data as well. So the provincial database really is meant for when you're offering the full survey. When you're just asking a couple of questions, you really don't get the full story about, you haven't asked the socio-demographic questions to be able to kind of look at who's answering the data. You're asking it in a very different way than asking the full survey. So that's why we've developed these other tools, so that hopefully it's still quick and easy and you can use the information in a similar manner for QI efforts, but we ask that you not put any information for these efforts into the database.
okay.
So Debbie, there was a comment by Chris Babcock that possibly video conferencing, has opened up the door for individuals who were initially not comfortable with it and now maybe becoming more accustomed to it, helping them able to get to a site, rather than getting, physically getting to a site.
Yeah, I think, I actually think, and I heard this from some others, that the community mental health and addiction agencies have responded incredibly well to the needs of their clients. It's so impressive what you have done and the changes that you've made, especially with the limited funding, the access to PPE, the having to completely turn things on their head. So congratulations to all of you. Yep, can you go to the next one? And I think I pass this back to Deanna at this point.
You do pass it back to me. So just want to reflect on the guidelines for using select OPOC questions. So we did share these with you at the last webinar 3 weeks ago, and they will be included in the resource package that comes along with the follow-up email as well. And so just a reflection that it is using using just a few questions is complementary to standard OPOC implementation. So the idea is that you still use the full OPOC at least once during the year. Question wording remains the same. Make sure that you're getting using specific questions and what are your questions. And Nancy and Chris Babcock had both highlighted earlier that they have added questions, and that really is the goal too. I mean, the OPOC questions are not designed to be getting at specifically what you're doing in your QI efforts right now, so don't hesitate to add other questions that are relevant to what you're doing, but it's really helpful to add 1 or 2 questions from the OPOC for that comparison, for those comparison purposes. The data analysis is the responsibility of the agency, but we've tried to make that easy for you. And just to kind of further to what I identified before, that the individual OPOC questions cannot be interpreted beyond the items themselves. So they're not representative or predictive of anything beyond the single question that they have that you're asking right now. The other piece that we wanted to talk a little bit more about, and Debbie had flagged this earlier, and we flagged it for you earlier in the last webinar, was what part of the client experience, these kind of questions that you want to ask and talk about with your team or just yourself if you're a team of one, to help you reflect on what's going to give you the most information and how you're going to collect it. So Debbie's talked a little bit about the part of the client experience you'd like to improve. Is that access? Is that the overall experience? And also we've talked a little bit about what's your plan for the data you collect. Are you going to do a pre-post comparison with kind of your change ideas during the COVID pandemic response, what is the plan for the data you collect? And that will help inform the questions that you choose and your plan for for actually collecting the data. What I'd like to talk a little bit about for the next few minutes is the best approach for collecting this feedback. So what does this actually look like for you? And it would be great to have you enter some information into the chat box. How do you see yourselves asking these questions? I know there are a few people there that are already doing this, but how do you see yourself asking these questions? What does this look like to you? Are you a team of one, and so you're working with one person who can do this? Are you a larger organization and you have administrative staff who might be helping to help collect information? When you're doing this virtually, what does this look like for you? So feel free to add some information into the chat box there. And maybe as you're thinking about it, I'll just give you a couple of other ideas. So for example, do you propose to, are you the only person at your agency that's actually working right now? Have you got other people who have unfortunately been, are not able to participate, or you don't have administrative staff? And so does that mean you just need to ask a couple of questions at the end of an interview? Is that the easiest way for you to do that? And if that's the case, what does that mean for your responses when you're the one who's provided the service and you're asking the question? So that's, yeah, clinician administered. What does that mean when it's clinician administered? Involving other frontline staff into the process, great. Small committee of 3, yep. Survey email to the client after virtual session, through groups, via email, those are all good suggestions. And so as we're thinking through that, let's talk a little bit about some of the pros and cons to those implementation approaches. So for example, if it is the same person, it's the clinician, as I just mentioned, who is asking a couple of questions at the end of the interview, what are the advantages to doing that? And what are some of the disadvantages to doing that? Convenience, absolutely. You're right there. It takes 30 seconds to ask those questions. You'll probably get feedback from every person that you ask, which may be very different than if you email something out afterwards. What are some of the disadvantages to that approach? Biased feedback, exactly. So unfortunately, if it's the same person that's asking the questions that just provided the service, the client might feel a little bit hesitant to provide negative feedback. And it's not necessarily that that's you have to weigh the pros and cons about how much data you collect and versus the bias that you have, and be able to just kind of talk through those pieces and those biases. So
just to highlight the SurveyMonkey program that's available. Some agencies that we've discussed with have a full account or a mid-level account, and are taking advantage of SurveyMonkey and some of the tabulation features, Deanna, that it can provide over and above the lovely template that we've created for people to use as well.
Yeah, which is perfect. And so how do you plan to administer that? Do you, if you're doing a video call, do you put the survey link in the chat box and ask the client to do it right then? Do you follow up via email and ask the individual to click on a link via email? What might be the pros and cons of those different approaches? Is your response rate going to be different if you actually do it through the chat box versus email? In terms of, one of the things that we have noted is that for organizations that typically do in-person surveys, where they're in the office with someone asking them to do a survey and they get a pretty good response rate, sending the information out by email doesn't result in as great a response rate. So just some of the things to consider. The other piece, absolutely, Shauna, is security. So that can be something that you really need to think about as well. In this situation, we are not sending any any keys, so the OPOC keys that you're familiar with that link the organization, the the survey responses to the program and organization. You're not sending out those because this is a shortened version, so you don't have the potential risk for that connection point between a survey key and a completed survey. But you do want to make sure that you're in your SurveyMonkey link that you're not asking for the client's name, unless that's something that you've talked about as a group and you've made it very clear that the client's information will not be anonymous. Debbie's pointed out that can a team member from another team ask your clients and you ask theirs? Absolutely. Some organizations are using staff that have otherwise been not able to work because their programs might be closed, and so they're participating in surveying right now as well. So I'm just looking, yeah, do you have any in-person services? Do you have someone who can do the data entry is another thing to consider. So if you are, is that one way you consider SurveyMonkey and setting that up versus our template where you actually have someone to do the data entry afterwards? And what does that mean from the, the way that your information is received and the results that are available? We also do have a tip sheet for administering the OPOC virtually, and so that will be coming out as part of the resources. And just a reminder that this is part of the client experience. You're not capturing the whole client experience at this point in time. So that really is what we had for discussion today. We've got a couple of resource slides. Chris, if I missed anything in the chat box that we want to flag?
No, just a broad comment of using support staff to ask questions over the phone, and it's turning out to be a great opportunity. Using students, placement if they're available, volunteers potentially as well is another reach out opportunity. So, take advantage of what may be available to you in the office to reach out to clients if clinicians are otherwise indisposed and not able to do that. Then take advantage of students and or volunteers and admin staff if they're available.
For sure. And as we mentioned before, there's no right or wrong approach. It's just looking at the pros and cons to the different approaches. And certainly your OPOC implementation specialist can talk you through that. And the QI and data coaches can assist as well from AMHO and CMHA. So just wanted to flag quickly that some of these resources that are available, well, these resources will all be sent to you as part of the follow-up email package. So the guidelines for using specific OPOC questions for QI purposes, the scoring template that we went through today. Again, this has the new run chart tab, which we didn't have 3 weeks ago, a frequently asked questions document about this process, and a new tip sheet that was just developed about virtual OPOC administration. We'll also certainly send out the QIOnTheFly template that you've seen a few times now, and we hope you continue to use. Okay, and Ash, I'm going to pass it back to you.
Perfect. Thanks so much, Deanna. So this information will also be included in a follow-up email that I'll be sending tomorrow that will also include a link to the recording of today's session. But I just want to flag a few resources you may want to check out for additional QI tools and templates, as well as profiles of some of the quick QI work that we're hearing from agencies on our website, www.equip.ca. You can also hear about upcoming QI on the fly sessions, as well as other training opportunities from the E-QIP team by following us on Twitter at equip_on. And we also have an online community of practice if you wish to carry on a conversation with other members in the mental health and community sector. Great opportunities to engage there on some of the topics that we're covering through this web series and other topics related to quality improvement. If we go to the next slide. So here we have a link at the bottom to join our distribution list. We're just shy of 900 folks that are receiving our E-QIP news. We usually send out a newsletter every 2 months or so, just profiling the great things going on in quality improvement with E-QIP, training opportunities, and ways to get involved. we also have a specific dedicated page to this Quick QI web series that I mentioned on our website. So we encourage you to check that out, and we'll be including that link in the follow-up email that we send out tomorrow. Go to the next slide. And if you could please take a moment and click where it says link to survey. It's a very short SurveyMonkey link. We'd love to hear what you enjoyed about today's webinar, what worked for you, what may cause for improvement to make these web series more relevant or more appealing to you. We're also very interested in knowing what future topics you might like to learn about. We have a few coming up in June. We'll be focusing on experience-based code design, but we'd love to hear what topics you want to learn more about. And I think that brings us to the end. If you just want to go to the next slide. So those are the registration links for the webinars that I just mentioned, so experience-based code design and a deeper dive with a how-to sequence. So those hyperlinks will work. They'll take you directly to the registration page, and we will be using the Zoom platform for both of those webinars again. You can check out the objectives for each webinar there. And if you just go to the next slide. And that brings us to the end of today's web meeting. So thank you very much for joining us. We're always pleased to hear everybody, and I hope that you're doing well during all of this. We look forward to having our next session in a couple of weeks and hope that you're able to join. If not, please do check out our website where you can catch up on our previous sessions, and hope that everybody enjoys the rest of the day.
Thanks everyone for joining us. See you next time.
Yep, June 17.